I was coming my way home from work, from the Bronx County Courthouse. I got on the train at 161st Street on the D train.
It was Friday, October 16th. I was working in the cath lab and I left work a little bit earlier than usual.
I did my normal routine. I take the A train down to the Long Island Railroad. I live out on Long Island.
I walked to the first car, which is the car that I always get on.
Everything was fine. I was on the A train. The A train was coming down to 125th Street. Normally I have a couple of people that I know who get on the train at 125th Street. The doors opened. Nobody got on the train. I figured I was just a little earlier than they were that day, and the doors closed. That was it. That was the last thing I remember.
And I saw a gentleman laying in the doorway, and it appeared that he was having a seizure. And then quickly, his face turned blue and he stiffened up.
Was clearly having a cardiac arrest.
The frightening thing is we couldn't find a pulse on him, and he kept becoming a deeper shade of blue.
Luckily, there was someone like Tony who was there willing to help.
We didn't even know each other before. We worked in the same institution, and we both had that same thought process. We have to help this man.
In some ways, you feel a little helpless on the subway because, there isn't a defibrillator right there. There isn't an anesthesiologist that can intubate the patient right away. It's like all of these people and things that flood into a room in the hospital when something like this happens, they're not there for you, so it's frightening.
Sonia and I kept alternating chest compressions throughout the whole ride down. When we pulled into 59th, the police arrived onto the scene, and that's when Sonia said, we're going to need a defibrillator.
We placed the pads on him, and the initial shock didn't actually resuscitate him.
We could not find a pulse. He was not breathing. He kept getting a deeper blue. It was pretty frightening.
The combination of restarting his heart and then getting some oxygen on board, he woke up.
When he took that gasp and his eyes opened up, it was a great, great feeling, it was.
So as we arrived in the train car, he had just started to take his new breaths. We did some life-saving measures to keep him stabilized and alive. We got him into the ambulance. We drove to NewYork-Presbyterian Hospital.
First thing I remember is being in the ambulance.
Slow down your breathing. We're going to get you to the hospital. Everything's going to be okay. There's no better feeling to know that this guy has a full recovery. He's living life to the fullest now after the chain of survival worked. We know that all of our training and efforts paid off.
He's very, very lucky. Most people that have an out-of-hospital arrest die.
I literally won the lottery, That's the kind of odds that I was against.
It was noted that he had a rhythm called ventricular fibrillation. We know that patients like this benefit from receiving an ICD, an implantable ICD, which is basically a defibrillator that we place inside patients. This defibrillator would monitor his heart, and if he should ever have this in the future, it would detect it and shock him out of it just the same way as he got shocked out of it externally before.
The qualifications of the staff and the people on the staff, but it's also that intangible of really feeling in my heart that these people really care about me.
He'll be seeing me to check his defibrillator. Our routine is to see him every 4 months or so. And with that kind of follow-up, he should do very well.
Especially for him, everything was just a nice, smooth transition of getting all the help that he needed, from getting his defibrillator put in and now to getting back into shape with rehab.
I can't put into words really just how much it affects me to know that there are people out there who seemingly are strangers to you who would make that kind of an effort to save your life.
And how soon did you go back to work after we saw you last?
Oh gosh, the following Tuesday.
Wow.
The rib pain better.
The rib pain. That was the thing that lingered a lot, but after 2,300 chest compressions, I would think so. As we approached Thanksgiving, it was a lot to be thankful for.
Your name certainly came up at our Thanksgiving tables.
It's a wonderful commentary on the entire hospital system and how much of a teamwork-oriented type of environment it is, really. It's just a bunch of wonderful, caring people.
Of course, he's trying to live life a little differently. It makes you think, makes you appreciate things. I was widowed 6 years ago. My husband died suddenly, unexpectedly. This time around, Michael got a second chance, and I certainly know that that's not always the case.
I actually went as far as to start my own blog. I'm going to use the blog as a way to journalize what I go through as I transform myself into somebody more healthy.
We have a great team here because our focus is always around patient care. Whether you're in human resources or a physician, you know, the thought process is we have to take care of people.
Even when I'm kind of yelling like, no, faster, like this has to be better, everyone just took the direction, and we all just worked together because we knew that there was no place for ego, there was no place for anything. It was just, everybody needs to just do what needs to get done to try to save this guy's life.
In my mind, I see it as a big responsibility to do the most that I can moving forward and not squander the opportunity that I got, you know, which is to continue living. I'm very, very thankful for the whole thing.